The federal government says the proposed National Disability Insurance Scheme will bring assistance to many, many, many thousands of people. But right now, a lot of people with disabilities are really struggling. Across Australia, there are over 6,500 young Australians living in nursing homes, we're talking aged care homes here, because of lack of alternative support or rehab services. A summit's going to be held this morning in Sydney to look at the problem that these young people and their families face. One group is calling for greater collaboration between health, disability and aged care services so that these younger people who are already suffering so much don't fall through the gaps. Dr Bronwyn Morcombe is the National Director of the Young People in Nursing Homes National Alliance. She'll be addressing the summit today and she joins us in the breakfast studio now. Bronwyn, thanks very much for joining us.
Thanks for having me, Fran.
Tell us about these 6,500 people who are falling through the gaps, because they're not really necessarily classed as having a disability, are they? What's their issue?
Their issue is that they have acquired disabilities. They've had an able-bodied life at some point before a disability came along, either as a result of an injury or diagnosis of a progressive disease like MS. And unfortunately, the disability system doesn't have the clinical supports that these young people need. They often end up in nursing homes because there is no other option, but they need health care as well to follow them out of hospital. That doesn't happen at the moment.
Isn't there healthcare available in nursing homes? I mean, apart from the obvious fact that a younger person in an aged care home, it's not a great fit, and we'll go to that. But in terms of getting access to healthcare?
Access to healthcare, modicum of healthcare, GPs come into nursing homes, but this group need rehabilitation. They need management of clinical care needs to enable them to go back into the community, continue their recovery. Without rehab, they don't get that and they can't get their lives back.
I think most people listening would think, yes, it's absolutely appropriate for a young woman, say, who's in her 20s, who's been struck with MS, gets progressively more ill and unable to cope. I don't even know if you call that a disability, do you? Or do you call it a disease? And yet there they are, and a nursing home is the only place for them. It isn't a good fit, to put it mildly.
It isn't.
Tell us about the impact that it has on, say, that young woman.
Okay, well, often these young women have families of their own, so they're raising children. Having to go into a nursing home means they have to literally leave their families behind. The children lose their mother, the husband loses his wife, and the young woman won't get the care she needs in the nursing home, despite the nursing home's best efforts. They aren't resourced for this group. They can't provide equipment like modified wheelchairs. They certainly can't provide rehabilitation, and they definitely cannot provide community access to enable that young woman to go back and see her family. So in all sorts of ways, the nursing home does its level best, but it struggles significantly. And the impact is deterioration of health, despite everybody's best efforts, rising depression, and complete impairment when it shouldn't happen. We could slow that disease progress if we had better collaboration with health.
Yes, it's not any implied criticism of the care they might get in an aged care home, but aged care homes, as you alluded to, I mean, they're quite depressing places, and you wouldn't be good for a state of mind of a young person who looks at their life being another 30, 40 years.
Absolutely, and that's one of the biggest issues we face, the social isolation that comes from living in a nursing home for these young people, and the fact that they can't get the health supports they need in the right ways while they're there.
You've had some really disturbing cases of younger people suffering at the hands of the system. What's happened to them? We
had a young woman who went straight from hospital to a nursing home without any rehab after a brain injury. One of the significant effects of a brain injury is contractures in the limbs. Her hands were so contracted that the nails started growing through the palms of her hand. In the end, the only way they could solve that was to sever the tendons in her wrist. She was regaining some function all by herself, but this meant by severing the tendons she couldn't drive an electric wheelchair.
But it's not uncommon for rehab after acquired brain injury to have a big success rate, is it?
Absolutely, but it usually happens in hospital, and it often happens where hospitals, because of their limited resources, will look and see whether they think the person can take advantage of it. With a brain injury, you need slow stream rehab over a longer length of time than a hospital can provide. So while the hospital will do what it can, it'll discharge once health gets stable, but the rehab stops at that point.
So what's the model we need? We've had a model in place that has worked, had some success. Tell us about that.
We have. In Victoria, there's there's a program called the Slow to Recover program that is a collaboration between health, disability and aged care. This program isn't specific to any one location. It can be delivered in the home, in a nursing home, in a hospital, anywhere. But it brings a team of allied health therapists to bear to develop a program of support. People who
sounds good. Why can't we just beef that up?
Indeed, why can't we? And it's an easy solution. All it needs is ministers, I'm afraid, who have to commit to this. So we're looking for health and disability ministers to get together to get that partnership underway.
Is it on their radar?
It's on their radar. I think everybody's aware they want to do something. They're just not quite sure how. We think we've got the answer, and it's a very simple one.
And is the answer just more funding?
More funding is important.
For this model?
For this model, but we also need the collaboration and the dedication, the commitment to do it.
And what about the National Disability Insurance Scheme? A lot of people are taking great heart at this insurance scheme. It will change their lives, but you're saying it won't necessarily cover the young people in this situation in nursing homes.
No, well, if it stays as a disability-only issue and a disability-only scheme, it won't. This work to get health and disability together is really preparatory work for the NDIS. If we don't get health at the table, working with disability, providing more attendant care support is not going to help this group of young people. We need to get them out of the nursing home, stop them going in, and give them the health care that they need, including the rehab, in the community. So we're looking to this work to start that pathway for the NDIS as well.
It's a matter of fairness from what you've described. It seems obvious it's a matter of fairness. It's also a matter of life and death, I think, from what you've said. You're going to be meeting with the New South Wales Minister for Disabilities, Andrew Constance, today. Have you had any indication from New South Wales that they're interested in doing some work on this?
I think at the meeting of Disability and Community Services Ministers, we did have an indication that New South Wales is very keen to tackle this from a disability perspective. The challenge is we've got to get health to the table, and of course disability is always the little sister to health. So there's significant socioeconomic benefit for health and for people in the community, for government, if we can solve this. I mean, to have somebody living in a hospital bed for 18 months, as we have an example here in Sydney, the cost of that is massive and it's a waste of health dollars. You know, it doesn't have to happen.
And have someone sitting in an aged care home for 40 or 50 years is not right either.
Absolutely.
Bronwyn, thank you very much for joining us.
Thanks, Fran.
Bronwyn Morcombe, Dr. Bronwyn Morcombe, she's the National Director of Younger People in Residential Aged Care Program. You're listening to RM Breakfast. It's